Well, we are in the last segment. I'm Dr. Hadar Spivak. Thank you for continuing watching. In the last segment, I want to talk about some information that I want you to have before you make a decision about the operation that you want to choose. The first thing is that look at your past and see whether you belong to the people who can comply with instructions in terms of eating, of course, in terms of your diet, where everybody went to, let's say, a place when they were given instructions and they lose weight. Were you the star there? Were you lost all of the weight that they expect you to lose? Or were you actually a little bit behind or a lot behind? If you're not the type of person that can lose weight with a non-surgical approach, the lap band, for example, or any type of gastric bending may not be a strong operation for you to lose all of your weight. At least then, look at the lap band as something that can help you lose some of your weight. And as I said, about 50% of your weight. But if you're not going to be happy with this, you have to look at the other options. And that's maybe the gastric sleeve. I say maybe because we don't know so much of a long-term effect of removing such a big part of the stomach. Or it may be the gastric bypass, as I mentioned earlier. So that's the first thing you need to look at yourself. How well you're going to comply with the post-operative lifestyle changes and instructions that you're going to get. The second thing that you have to have realistic expectation. Roughly speaking, the lap band on one hand can help a person lose 50% of the person's excess weight. And you know what's your excess weight. You look at the charts on the web and you find out how many pounds you're above what you should be. This is your excess weight. The lap band will help you cut half of it. The gastric bypass, on the other hand, will help you cut half of your weight if you're above 350 pounds. So if you're above 350 pounds, let's say you are 400 pounds, if you choose the gastric bypass, you're probably going to lose about 200 pounds, half of your weight, the whole person. And if you choose the gastric bending, you lose 50% of your excess weight, which for 400 pounds may be just 120 pounds. Still, you'd be much better off being 280 pounds than 400 pounds, but it's not perfect, as we mentioned earlier.